What if you had to say goodbye to your fur baby? What would you want that experience to feel like if you had to make the difficult decision of putting your beloved animal to sleep? What would you want to feel like when moving through that process? What would you want your pet to feel like? How might you be able to find a little bit of solace and calm and clarity and be able to give that gift to your pet as well during one of the most probably emotionally painful or difficult experiences of your life and maybe even your pet's life. These are some of the things and questions and ideas that we are going to explore today on the Street Dog podcast, brought to you by the Street Dog Coalition. We are a national nonprofit providing free veterinary care and related services to pets of people experiencing or at risk of homelessness. I'm your host, Daria Tavana, and I'm also the Director of Development at the Street Dog Coalition. And today we have the privilege of speaking with Dr. Kathy Cooney. Kathy is a renowned expert in advanced end of life care for pets and currently serves as the Senior Director of Medical Education for the Companion Animal Euthanasia Training Academy. With over 15 years of experience in this incredible field, she has authored two influential books and has been a strong advocate for best practices in companion animal euthanasia. So, today we're going to delve into the important topics surrounding euthanasia, including the significance of the bond between caregivers and their pets, some essential components of humane euthanasia, and how unique situations can still honor the dignity of our beloved animals. So, welcome to the podcast, Kathy.
Thank you so much, Daria, for having me. I've been looking forward to this for a long time.
Yay! I'm so glad. And we've been really looking forward to hosting you. And man, I gotta say, I know that I just scratched the tip of the iceberg in terms of your credentials, your experience, your background, your history. Calling you a leader in the field is honestly an understatement. Your contributions to humane euthanasia, not only on the animal side of things, but on the human experience side of things is really impressive. And just to know you and to be able to have this conversation with you, someone who answers the call of people who are oftentimes, experiencing a lot of stress, a lot of confusion, not knowing what to expect next. Like I'm just I'm really excited to have this conversation with you because I've had to put pets to sleep in the past. I know that everyone listening to this podcast has either had to do that or has known someone who's had to do that. So maybe Kathy, you can kind of kick things off by maybe discussing the significance of the bond between pets and people, especially when it comes to those end of life decisions. How does the human animal bond, as you know it, as we here at the Street Dog Coalition try to protect, how does that like influence the decision making process?
Yeah, I think one of the best ways for me to start with that is to share what brought me into vet med in the first place.
Yeah.
And then eventually becoming what you might call an end of life specialist or a death specialist, because that was not the plan. Yeah, I grew up in Michigan, even though I'm coming to you today from Colorado. I grew up in Michigan. We had family pets. We had dogs and cats, and we had some rabbits and even horses. And I remember some pretty pivotal days when we lost them, when they died or had to be euthanized, and the grief that came over our family, the heartache, the fogginess of the brain that I experienced very early as a child that now is carried into adulthood, and I understand what my grieving clients go through. So I was shaped very early on by the losses of my own pets. When I decided to go into veterinary school, it was actually to become a horse vet. I thought I would be all around equine medicine for years and years. But I found that what really resonated with me was more of a small animal medicine, first of all, but also within small animal medicine was the connection that I could make with families, with my clients, with these pet owners on a much deeper level during end of life conversations. And why that was so special is because that's when I got to the heart of the bond, where they would talk about their love of this animal, all of the ways that these animals have come into their life and how they got their name and all the fun memories and journeys and adventures that they've had together was a beautiful part of those conversations and then interactions that I'd have. Now, clearly, because these are euthanasia discussions, there's sadness that's layered throughout that, but it was still so powerful to witness that human animal bond. So then my mission became, how do I help these families say goodbye in the right way?
Mm.
So that when they look back on this time, that they know they did everything to the best of their ability, that they said goodbye in a meaningful way, and reducing regret and guilt over some of these decisions, which is just so common, right? How do we not feel guilty about making a decision for euthanasia when there's so many unknowns that are out there? But I want these families to feel as good as they can in a very sad time. So I have weaved my entire career now around improving euthanasia, improving quality of life discussions, improving the option of palliative care, because maybe the time isn't right for euthanasia. And then, of course, afterwards, how can we honor this now deceased pet through memorialization and really good aftercare?
Wow. That is so beautiful. It it never occurred to me to, what you're saying makes so much sense, and it didn't occur to me that you would be sharing in this really beautiful, formative experience with these families until you just shared that with me. Like, now that you say it, I'm like, "Of course." Of course, that's such a beautiful experience. Of course, to be able to, like, hold space for families that clearly love their animals, like, to the end of the earth and back is extremely rewarding as a veterinarian. And we have, Timothy, one of our incredible supporters, founder of Harmony Dog Rescue, just commented and said, "This is such an important conversation. Thank you for having it." And it's true. These kinds of conversations can sometimes feel like taboo, or like we should only celebrate the highs and not the lows. But what I'm hearing is that, in its own way, this experience can be a high point, can be, I don't want to glamorize death, or glamorize the space and the tears that you hold for people. But if we only change our perspective, if we change who we invite to be part of that process, like someone like you who has this kind of expertise, the experience, the grief doesn't go away, but the experience itself can feel a little bit more like ceremonial and a little bit more beautiful, like a celebration of life of this beautiful animal. And I imagine that in your long career, you have come across like a lot of different misconceptions when it comes to euthanasia. And I'm curious to know if there are some common misconceptions that people have about euthanasia, and how, me and you and our friend Tim here who's tuning in live, how can we kind of like better educate pet guardians and caregivers about euthanasia?
One of the best ways is to start early talking about euthanasia with pet parents.
Mm.
To, when we've got a pet that is aging, whether or not they're reaching more mature senior years, or now they're, further along in their life and quite geriatric and frail, or when there might be an earlier disease that's been diagnosed that we think is going to be life limiting, that's going to cut that time short. one of the best things that veterinary teams can do is start to open up dialogue around euthanasia sooner. Because I think one of the misconceptions, to your point, is that it's improper to bring it up. It's
Mm,
improper to talk about it. But by avoiding it, we all kind of do each other a disservice. Like we're all kind of skirting around the issue. Like, can we bring up the E word, even though it sounds like a U word? Can we bring up that E word and go there? My answer is always yes. So let's lean into it, because if we don't, and a pet parent is thinking about it, but the veterinary team didn't bring it up, they might think, well, maybe I shouldn't. Maybe it is too early, but I'm really thinking that it is the right time to make a choice for euthanasia. And a lot of times veterinary teams think that if they bring it up too early, they're somehow giving up. But if we look at the conversation around euthanasia is simply giving information, giving another choice on a platter of choices that a pet owner can think about, like, palliative care to full-on hospice care, which can be a little bit different, to euthanasia versus doing nothing. We always want to do something to make sure that our pet is comfortable as they reach the natural end of their life. But bringing it up with then now this platter of choices is the right thing to do. It brings us to a faster win-win-win in a time where it can feel like a lot of loses, or a
mm.
lot of, just loss, but a lose. That's what we're trying to avoid. So a misconception, first of all, is that we can talk about euthanasia sooner than later. I think another misconception out there is what really takes place during euthanasia. Back in the day, euthanasia used to be a bit more clinical than what it is now. And that's certainly been my movement with the Companion Animal Euthanasia Training Academy, is changing the narrative around this procedure and all of the essential components. Back in the day, it was very clinical. We're going to bring an animal into a room. We're going to, restrain quickly and give an injection in the arm, and the animal will pass within a matter of 10 seconds right there in front of us, which can be rather jarring, right? Especially for a loved one who isn't ready for that speed of euthanasia. These days, euthanasia has been evolving. It tends to be much slower as far as sitting down, establishing rapport, making a connection with a client, on the veterinary team's directive to make that connection and build that trust, talking through the aftercare options and memorialization, because lots of choices out there now on that. And then taking a little bit of time to describe what's going to happen. But these days, because of groups like the American Veterinary Medical Association, the American Animal Hospital Association, and Fear Free and CAETA, we are all now advocating for animals and these patients to sleep in their final moments, right? To give medicines first to invite that sleep, let go of any of the pain that they've been feeling and that discomfort or anxiety, and sleep in those final moments. And then the euthanasia solution, or whatever technique is being used, is facilitated.
Mm.
So misconceptions are that, euthanasia is, really rapid, where families can't be there anymore. These days, it's more like a pseudo funeral.
Wow, and it's really beautiful to hear you speak into both of these different misconceptions. I think the first one resonates with me because, yeah, it makes sense. If we can introduce this idea to pet parents early, then when the idea crosses their mind, like you said, or when someone might even mention to them, like, don't you think it's time to consider euthanasia, that they might not be as triggered in that moment as they might be, because that conversation has already been introduced. It's already been kind of laid out there. So whenever that thought or that conversation comes back up again, it's not a surprise. It's not like, oh, what are you talking about moment. So like anything, if you kind of introduce it so that we can anticipate it as needed, it seems like it's a little bit less, you know, of an attack, which of course it never is. And I also really appreciate you shining a light on what these euthanasia experiences can be like. They can be these beautiful, ceremonial, small, tiny rituals that bring a sense of closure, in addition to all the other feelings that you're feeling, like grief, disappointment and sadness, maybe some relief. So it is really beautiful to hear that you create an environment where all of these emotions and all of these experiences can exist at the same time, right? And there's nothing wrong with that. It's all part of the human experience, and I really appreciate that. And I have to imagine that that's that can look and feel different depending on, the setting of the euthanasia. And I know that, you've noted in the past, euthanasia can take place in non-traditional settings. This is something you and I kind of spoke about briefly whenever we chatted on the phone a while back. Euthanasia can take place, especially in the case of some of our clients, in a van or a different kind of home, if you will, a non-traditional home. So, how do you approach these more unique situations to ensure that the process really remains respectful and dignified, regardless of where the pet guardian calls home?
Yes, yes. Euthanasia can occur just about anywhere where the pet can be safe, where the loved ones can grieve in hopefully some semblance of privacy, because I have performed euthanasias in rather public places, and where the veterinary personnel, whether or not it's just the veterinarian or with a veterinary technician or other support assistants, where they can do what they need to do. Because at the end of the day, euthanasia is a medical procedure, and we have to release this animal from their body just as gently as we can. So there are requirements that need to be met for that. But that environment around the animal, the pet patient, you hear me use all these terms, that as long as that can be protected, euthanasia can be anywhere. So I've euthanized, I dare I say, mountaintops. It's pretty darn close. I live to the, about half an hour away from the Rocky Mountains. So I have euthanized up in the mountains and snowstorms and on, beaches of lakes and in the back of vehicles, certainly in homes for many, many years, as I was a home euthanasia provider in Northern Colorado, and then actually ended up building a little euthanasia comfort center here where families could come to me, which is a very special space. But the hospital, even though it can be busy with lots of things going on, if the team and the family is able to kind of block all of that out, the busyness of a vet hospital, create this little bubble around the euthanasia room, it can all be beautiful, just
Mm,
absolutely beautiful. And I know that a lot of veterinarians and professionals have been gravitating more towards home euthanasia services
yeah,
because of the variety that that provides and the comfort and the softness of home that so many owners are looking for.
yeah,
So at the end of the day, euthanasia can be conducted anywhere where the medical procedure can be safely facilitated, where people get to love and grieve over their pet, and then where of course aftercare can be safely facilitated afterwards, because it's a big difference euthanizing a horse at a family farm versus a rat that's come into the hospital, right, for an exotic euthanasia. There's just a lot of things to contend with, but it can all be done with pre-planning, which I hope is the big takeaway message of this podcast, is talk about it, figure out what needs to be done, get everybody on board, and then the family, the loved ones can really shape this the way they want it to be. Because when that happens, Daria, they're more balanced, they're more fulfilled, they feel that their pet's life has culminated in a good way. Good life deserves a good death. And one of my big missions is that people are more willing to go out and adopt again, and ideally adopt a senior pet,
Mm.
because they feel now comfortable in this journey and they're less afraid of it.
Oh, that's like the mic drop moment right there. That's so beautiful. Like, so what I'm hearing here is that just like there is, just like every animal is different, there is no real one size fits all approach to these scenarios. There's some incredible tools you've given us on this episode so far, some guidelines, some things to keep in mind as veterinarians when we're performing euthanasia, as pet guardians when it comes time for us to make that difficult decision, and this idea of providing people with, the comfort to feel what they need to feel, and the confidence to risk feeling that all over again is incredible. It's beautiful. It's something that, I've experienced as someone that has had to put animals to sleep, and it's just, oh my gosh, I'm like speechless. It's gorgeous. That's such a beautiful idea. Is like, what if we can create an experience, a ceremony so beautiful that after a period of time, of course, after the grieving, comes to maybe a pause, that this individual is open to adopting a pet again, a senior pet. Like, oh, that's so cool. And I'm wondering, Kathy, this is my last question for you here, because I could talk about this forever. I actually had a little orange cat that I had to put to sleep, maybe like 10 or so years ago, that like changed my whole life. I went vegan after I had to put this cat to sleep. This was before I did anything animal related professionally, and it's probably the reason I'm here with you now on this call. So it's quite amazing to see how losing a pet can, um, we're at this juncture where we can decide what to do from here. We can just decide what to fill that grief hole with. So, before I go off on a tangent here, my my final question for you, clearly you have extensive experience in this field. Has there been an impactful patient, an impactful a set of pet parents, or a specific moment for you in your work with end of life care that has really stuck with you? Um, and how has that moment maybe shaped your approach to helping pets and their families in this time of need?
Sure. I can think of some of my own pets, first of all, that I didn't realize had the impact that they did until after I graduated veterinary school and was in practice. But I remember when I was a child, I had a Great Dane. We had many Great Danes when I was growing up, but this one had a strange story where she was unfortunately hit by a car.
Oh.
Very rare. We'd never had that happen with any of our animals, and somehow it happened to her. And when that incident occurred, she was, of course, very injured. And I remember my father making the decision to take her to the emergency room, 10 o'clock at night, and have her euthanized, and none of us were there. I was maybe 8 years old, and he took her by himself. And I remember later thinking, I wonder what that really looked like.
Mm.
Bringing her into the emergency room, being a large dog that she was. And my last memory of her was laying in one of the rooms in our home. And I do recall kind of thinking, I wish she could just stay there.
Mm.
Why did she have to go anywhere? So that actually became a pivotal, uh, touch point for me, remembering back on that. Like big dogs, they're lovely to just keep at home for euthanasia. When I graduated veterinary school in 2004 from Colorado State, my husband and I had an elderly dog, and we were getting ready to move to Michigan, where I was going to do a couple of years of private practice there. And we made the decision that that old yellow lab would not go with us because it would be so hard on him. He was 15 and a half at that point, which is pretty old for a lab. And he had a lung tumor and all of his age-related changes. So we made the choice to euthanize him at home, kind of bringing me around full circle from my Dane experience to now being able to do that for our lab. And it was wonderful, exactly what we were hoping for. When I ended up practicing in Michigan, I had probably the most important patient there of my career. It was a dog that I was treating for lymphoma, a type of cancer.
Mm.
And I was working with this dog for a couple of months before I got the call on, I believe, a Sunday. I happened to be the doctor on emergency, got the call that this dog was not doing well. And I said, go ahead and drive to the hospital. I'll meet you there and we'll see what needs to be done. When that family brought the dog into the hospital and I could see just the horrible shape that he was in, struggling to breathe, gasping for air, his chest was filling up with fluid. We ended up euthanizing that dog right there on the lobby floor of that hospital. And two things came from that. First of all, more inspiration to start offering euthanasia anywhere that the patient could be, anywhere in the home or in a comfort center somewhere that we didn't have to bring them necessarily into the hospital. And again, you can have beautiful euthanasia experiences at the hospital. I don't want to always send that message. But I said, where else could I have served this dog? The second one was that I wasn't exactly sure as a veterinarian how to perform euthanasia on such a critical patient on a lobby floor.
Yeah.
I only knew how to do one thing, and that was to give an IV injection of pentobarbital. So that day really shaped me to ask, well, first of all, can I help patients in a better way in other places? More pre-planning, more talking through things rather than emergency basis. And how can I educate myself on all of the possibilities with euthanasia techniques? And then now, how could I bring that forth to all the veterinary professionals out there that received very little euthanasia education? I think that's another misconception, is that veterinarians and veterinary technicians get all these hours of euthanasia training and palliative medicine and those things, but it's really not the case. Sometimes veterinarians will actually graduate vet school, maybe having never performed a euthanasia.
Wow.
And so we have an opportunity to teach more and more and more. So that dog, I'll just share, his name was JD, stands for John Deere. I've spoken with the family since. And, JD was a game changer. So he is the reason why I do what I do now, and out there spreading the good word about how to shape these euthanasias forever. And I'd like to also close with a couple of key things that all veterinarian professionals should know.
Please go for it.
Yeah,
Take your notes out, everybody. Let's write
that's
these
right. Get ready
down.
for notes.
Gems of wisdom.
Is we advocate for CAETA's 14 essential euthanasia components. And 14 because there's 14 letters in the two words good euthanasia. So veterinary teams want to provide, like the letter G in good is grief support materials provided. Letter O, offer privacy before and after the death. Another letter O, outline caregiver and pet preferences, right? What do they want? And the letter D, deliver proper technique. So I'm not going to go through all of them, but they all bring out this magic recipe that veterinary teams can think about before the appointment. Like, are we ready to do these things? During the appointment, are we? And then afterwards, did we? Then they can start to build up their euthanasia operating procedure, their manual, to make sure that everything gets included. Because what we know are the top 4 things that every pet owner wants during euthanasia. Number 1, they want the option to remain present for the entirety of the procedure. Number 2, they want more help with pre-planning, right? They want to make this a memorable event to whatever that looks like for them. Number 3, they want their pet sleeping in those final moments whenever possible. So use of those pre-euthanasia medications. And then the last one is they want this to be as pain-free, anxiety-free as they can make it, and that their pet knows that they're right there loving them through everything. So if pet owners can, gravitate towards the things that are meaningful for them, the veterinary teams can align with it, that's when we get to the sweet spot of having euthanasia being a positive rather than always the negative.
Mm. Oh my gosh. I am like crying with my eyes, but smiling with my mouth, which is probably like your goal here. That's so, so, so beautiful. These key reminders and just the outline that you started to sketch for us is so pivotal. And at the Street Dog Coalition, we have so many core values, but this is really reminding me of the main value of that we have of trust. So when you have a plan, when you're being proactive as a veterinarian with your euthanasia, with the strategies that you employ, with the education that you have, then you find yourself in a position to be able to facilitate these euthanasia appointments with extra care. And so instead of what I'm hearing is, instead of being reactive, despite lack of experience in some veterinary programs, it's important for veterinary professionals to be proactive, to educate themselves, to and to kind of think outside of the box as well, and provide these families and these animals with just this gorgeous, beautiful, pain-free send-off, which is so important because, as we know, anyone who's lost a pet, after they leave that appointment, if that appointment is not in the home, that's kind of like where the real work begins, where you start to really move through the grief. Even if there is a sense of peace, even if that animal was in pain for a long time, that's in many ways kind of just the beginning of the grief. So to be able to cultivate that gorgeous experience is a true gift that you have, Kathy. And I just know that everyone who learns from you and comes in contact with you is so, so, so grateful that you're able to be a leader in this field and inspire people to think outside of the box and to be prepared for these hard conversations and moments.
Thank
And
you.
Kathy, I want to thank you so much for coming on the podcast today. I want to let our supporters know that I've included a link to the Companion Animal Euthanasia Training Academy's website in the show notes. Please go check it out. It's incredible. I learned so much as someone who is not a veterinarian, just looking through the website for a period of time. You have so many incredible resources, and yeah, it's a real pleasure to know you, Kathy. I want to thank you so much for, again, all the different ways that you've supported the Street Dog Coalition, and the ways that you support the veterinary community and animals and people who really need you the most during, what could be their darkest hour. You seem to really provide that little light at the end of the tunnel. So thank you,
Thank
Kathy.
Thank you, Daria. And I'm going to push that gratitude back out to you. Thank you very much for the invitation. And also putting out the gratitude to the pet owners that are willing to take on the personal pain to let their pet go through something as hard as euthanasia, right? That's where euthanasia becomes a very selfless gift. What other gift do we give that we take on such personal pain? And I often say, the only way to make, pain or discomfort or the struggle that an animal is going through, the only way to make that end is to make the loved one's pain and struggle and grief begin. So it's kind of like it has to transfer somehow. So thank you to all of those out there that are, doing something very, very hard to say goodbye to a pet. And to thank you to all the vet professionals out there doing this work and taking care of their families in such a beautiful way. You are angels as well. Thank you.
So beautifully said, Kathy. Thank you again. I don't know if I should laugh or smile or cry, and I think I'm gonna go do a little bit of both. This was touching, really eye-opening and heartwarming, and I appreciate you again, Kathy. Thank you so much. We'll have to have you back soon.
I love it. Anytime.
Take care, Kathy. Until then.
Thank you.